And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. Is codeine not something that we want our kids to take?
Not at all. I mean, it's a powerful medication, and we all are aware of the dangers. Most physicians and healthcare professionals know that it's one of those medications you try to stay away from. It's a high-risk medication. Being a healthcare professional is risky enough, and so you try to stay away from prescribing risky medications or doing risky procedures. But sometimes it is called for. It's just that those instances are typically in the rare section and not the more frequent section, just as the pediatrician mentioned. Honey and Tylenol, ibuprofen, those things have been around for a long time. They still work. Do no harm first is normally the first thing that we think about, and I know that can be tough sometimes in situations when someone is in severe pain. There is some chance that they might get a strong medication, but briefly, not something that we want to do chronically.
So as far as severe pain, I mean, some people have very low tolerance for pain.
Absolutely.
So is that what we're talking about, or are we talking about very severe cases of like the flu or RSV or something like that that you would give a child codeine?
Well, I don't normally do pediatrics, but in my residency or in my training when I was in medical school, we never used codeine in those situations. Again, they're already compromised, and codeine can depress the respiratory rate, and so we don't want to add fuel to the fire, so typically not. But let's say they had a fracture or some other problem that is causing severe musculoskeletal pain or abdominal pain, you know, we might use some strong medication because they are suffering and we want to relieve their suffering. Pain used to be considered the sixth vital sign because at one time physicians kind of ignored pain, and then we prioritize it, and then we're trying to bring it back to its proper perspective because we have been in a situation we've been over-medicating patients a lot, and patients are getting addicted and having a lot of side effects. So it's a give and take like anything in medication, risks, benefits, and we have to individualize the case.
All right, on to some of our viewers' medical questions. This person wants to know, as far as bunion surgery, where would you go here in town?
Certainly podiatrists are a person to start with. They have about 4 or 5. Actually, my sister podiatrist here in town. But certainly that is a person that I would go to. They are trained in foot surgery. They are surgeons, so I'd probably start with a podiatrist.
Okay. What are the pros and cons of shots for babies? I'm sure this person is asking about immunizations.
Yeah, I mean, I think we love immunizations. We want to protect the babies as much as possible. I think immunizations, vaccines has revolutionized medicine, so we're big believers in that. But with anything, there's always a potential for risk, but it's in the scope of trying to immunize society and limit the spread of infection as well as the severity of infection. Infants and little kids are the vulnerable aspect of the society as well as older patients, so we're big believers in it. We want them to get all their immunizations when they are due.
The risk is very small in
The risk is always there. Unfortunately, in medicine, there is never zero risk,
right,
no matter what we're doing, but it is a small risk, and it's in the benefit of immunizing society. As again, I mean, we used to die from infections here in America when we settled this country because of things like antibiotics and immunizations, when we've been able to overcome that, but it's still a battle every year, just getting patients on board to get those immunizations because they do work.
All right, one more question before we go to break. What's your opinion of post and pre-workout shakes?
Not a big fan of those. Obviously, I'm not a bodybuilder, and I know that a lot of people do them. If it works for you, that's fine. But medically speaking, no, there's no medical literature that says you need a pre and post workout shake. It just doesn't exist in terms of medical literature.
All right, but you do advise working out and keeping on that routine.
Absolutely. And it doesn't have to be 2 or 3 hours, just something at least 20 minutes, 5 days a week, jogging, bicycling, just something.
Or walking. Just
walking,
as simple
perfect.
as walking.
Absolutely.
All right. We've got lots of other medical questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. 70-year-old female asks, could there be something wrong with the nerve in my 76-year-old husband's leg? He's in constant pain when he walks, but has already had several cortisone shots.
Yeah, probably so. Anytime we do cortisone injections, that probably means he has a pinched nerve in his back. That is one thing that we can do to alleviate the symptoms, but sometimes it doesn't work. And normally if the conservative, non-surgical approach doesn't work, then probably he needs surgery.
At 76?
At 76, absolutely. The techniques are getting better. The anesthesia is better. And these are the patients that normally require surgery. The elderly population with severe DJD or degenerative joint disease in the back. It's just been going on for years and years, and finally it's just gotten so worse that they need some sort of surgical operation. Certainly the surgeon will do a proper evaluation, make sure they're able to tolerate the surgery, but a lot of 76-year-olds do get this surgery, especially if they're high functioning.
Okay, a 32-year-old female. My 2-year-old is having trouble with allergies. I think we all are. Is there some over-the-counter medicine that I can give him?
Yeah, I certainly would try the over-the-counter medications for kids. Antihistamines, Benadryl has been around for years. It works really well.
And they will sleep like a baby.
Yes. There may be some non-sedating antihistamines in the pediatric world. I'm not quite sure. I don't do it every day. Certainly in the adult population, we have Zyrtec, Allegra, Claritin, a whole host of things. Singulair.
Can the child take that or no?
I don't know, to be off the top of my head, because I don't do pediatrics every single day. Certainly check with your pediatrician because of their weight and developing bodies. Sometimes they just cannot tolerate certain medications. But I know Benadryl is there. And again, Singulair, I think, can be used in the pediatric population as well.
Okay. 63-year-old female. What's the difference between medical doctors and an osteopath?
Sometimes lettering. A medical doctor is MD, osteopathy is DO, and I think the concern is, are they less well educated? Absolutely not. I've worked with DOs for years, and they're some of the highly trained physicians, just like medical doctors. There is a different concept when they aren't training in terms of their approach to illness, but when they come out, they're just as well trained as an MD, and certainly would recommend to anyone to go to a DO. They're just as qualified, and I've met some MDs that aren't so good as either. So you have to be careful. Just do your research, but DOs are well trained.
And they can prescribe medications. They can
just
do
like a
everything,
medical doctor. They're surgeons,
okay.
They're heart surgeons, they're anesthesiologists, gastroenterologists. So they're right there with us. They're our brothers, and we honor them and we work with them, and they're well trained.
Okay. 40-year-old female. What can you do about a really bad sunburn?
Probably for this person, don't try to reduce their exposure to sun in the future.
I think we're past that point.
Yeah, the burn is basically damage to the skin. Anything that soothes the skin, aloe vera, etc. Sometimes pain medications might need to be used. There's probably some home remedies that work really well. I'm unfamiliar with those, but certainly try to just reduce your exposure. We talk about that all the time. Excessive sun exposure causes premature wrinkling, increases your risk of skin cancer. So I know we all like that certain look, but it just kills your skin over time, so it's just not a good thing to do.
What do you do when it gets to that itching point?
Probably antihistamines can be tried for that. There's also hydroxyzine, which is a medication we use for itching. So normally we can get it under control.
All right, Dr. Levine, as always, we appreciate you
Yes,
stopping by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kftm.com, or you can post those questions every Monday on our KFDM News Facebook page.